الله لا إله إلا هو له الأسماء الحسنى.
And the only thing that no one can deny is death and maut. There is people out there who do not even believe in Allah and God, which are known as those people who deny the existence of a creator. And everyone has their own belief and their own way they deny things. But one thing no one can deny is maut and death. Allah subhanahu wa ta'ala says that every soul will test death. Every soul. And Allah subhanahu wa ta'ala says in another place, كُلُّ مَنْ عَلَيْهَا فَانٍ وَيَبْقَى وَجْهُ رَبِّكَ ذُو الْجَلَالِ وَالْإِكْرَامِ. Every single thing will perish. Every single thing. At the end, hadith are saying that Jibreel alayhi salatu wasalam, Malakul Maut and Israfil will be left. Even Malakul Maut will be ordered to finish Jibreel alayhi salatu wasalam and Israfil alayhi salatu wasalam. Then Allah subhanahu wa ta'ala will ask Malakul Maut, Israel, is there anyone left? Israel, Malakul Maut will say, it's only me left. Allah subhanahu wa ta'ala will say, finish, perish. And when Malakul Maut will decease, when the Malak Maut will die, the scream the Malakul Maut will make, it will be very heavy. Then Allah subhanahu wa ta'ala says, كُلُّ مَنْ عَلَيْهَا فَانٍ وَيَبْقَى وَجْهُ رَبِّكَ ذُو الْجَلَالِ وَالْإِكْرَامِ. The only Allah subhanahu wa ta'ala will be left. So, when we know that maut is haq, death is haq, is reality, we cannot deny it. We even know in our physically and in our mind, we know, in our heart, deep down we know that we are going to die, but we are not preparing for it. Individually, every one of us should be prepared for maut any time. Anytime the Malakul Maut comes, we should be ready that our soul can be taken out and departed from this world, and we can face Allah subhanahu wa ta'ala and face everything in the grave. That's how we should be. That's individually in our personal life. But for others too, that we should be prepared that one of our loved one can die anytime, maybe me before them. But do I know all the steps to take from Islamically and according to law of the land? Islamically, how do I deal with the body when someone passes away in front of me? What do I do? Do I know all the stages of washing and the graveyard and everything, what to do? Now we have to ask this ourselves. And we should know what to do. This is Farz on us to do. And I say this various times, that when our beloved dies, we should be the one to take care of them, not someone else. We shouldn't be asking someone else to come and help us with our disease. We should be able to take care of our relative ourselves. That's the criteria we need to know. Number two, what is required according to the law of the land? These things change, varies all the time. So a few months ago it was something else. Now it's something else, and we have to catch up with these things. For these reasons, I appreciate the time of Dr. Amir and Dr. Zaid. From their precious time, they have taken some time out and they come to our masjid to explain some of the things what they can explain in this less amount of time. I want everyone to listen properly and focus on what the brothers or the doctors are saying, and future wise, we should have the full, try to get to gain the full knowledge of all these things. And we need to know all these things. This can happen to everyone now or later on. So it's very necessary. I appreciate Dr. Saab giving us time. In the past, nearly every year, twice a year, Dr. Saab, at least twice a year, he gives us time from his precious time. He comes and teaches us a lot of things. And we have learned a lot of things. And may Allah subhanahu wa ta'ala reward him. Jazakallah khair. Ahsan jazaak.
Jazakallah, Mufti Saab, for inviting me and giving us time. Assalamu alaikum, brothers and sisters as well. So, every year, couple of times in a year, I do come to the mosque and I feel very welcomed here. And it's a great opportunity to give you some healthcare advice or the processes related to the healthcare. And at the same time, it's a great pleasure to meet our brothers and elders. It's always, uh, they love us and they show a lot of respect. Thank you, everybody. Jazakallah. So today I've come here with Dr. Zahid as well because there's a change in the law. And Mufti Saab mentioned about death and law of land prevails. And law of land is something that will affect the processes despite of our religious beliefs and cultures. So I wanted to give you a little brief explanation. I'll not take much time, but try to be brief. But I'll be around for any questions you've got after the namaz, inshallah. So we all go through this process with a loved one, with a friend, with a relative, with family members who die, and most of the time we don't know what is the process, what happens, who to call, where to go. So I'll briefly describe two things here: uh, an expected death and unexpected death. So there's an expected death when person is unwell and he's expected to die, what the process involved, and when somebody dies suddenly, and what process to follow in that case as a family member or a friend at home. Death is a painful process. The person who dies has gone, but for the bereaved people, for the family members and friends, it's difficult because they are grieving and they have to also make arrangements for the funeral, janaza, and also duas, and there's a lot of things happening at the same time, and at the same time we are grieving as well. So it's difficult time for the family members and relatives and friends. So from religious point of view, we are, as clinicians, being a Muslim, we are aware that it's a right of the deceased to perform janaza as soon as possible and do the burial as soon as possible. But as I mentioned, that law of the land prevails, so there are some hindrances or steps which delay this process often, because most of these things are done within the working time, and weekends, and at night time it can be difficult. So I'll explain that as we go along. So first thing is unexpected death. When somebody dies at home suddenly and a family member is there, obviously your first instinct is to call 999 or ambulance, which is the right thing to do. And you would call them. Sometimes you can call your GP to get advice what to do if you're not sure, but 999 and ambulance call is the right thing to do. So you would call the ambulance will come, try to revive the person, do the CPR or resuscitation if appropriate, and if that fails, then they will declare the person dead, or and then they'll confirm the death. After the confirmation of death, they may involve the police, because when any sudden death happens, this is the law. They have to, by law, involve the police. A police carries out investigation to rule out any unusual circumstances of the death. Police will speak to the doctor as well. Police will do the investigation, complete the investigation, and then GP will be informed. GP will refer the death to the coroner, and coroner will investigate it further. So death certificate cannot be issued until the investigation is completed. In some cases this may be quick if GP and coroner have a discussion on the causes of death and possibility of death, then the certificate can be issued. In certain circumstances, post-mortems are required, or more investigations required, that delays the process. and it can take a few days up to a week as well, depending on what processes are involved. um, so the coroner is informed as soon as we are informed that there's been death and is a sudden death and we don't know what is the cause of the death. We would refer to the coroner. Same happens in hospital. If somebody is admitted to the hospital, say like with a chest pain, goes into, and they die within 24 hours of the hospital admission, that death will be a sudden death as well and needs to be investigated in the same way. And once the coroner is satisfied, only then a death certificate will be issued. This has not changed. This is the same as we have been doing for years. This hasn't changed. Expected death is somebody who has been unwell, he's been seeing his GP or doctors, or he's already in the hospital on through because of an ongoing illness, and they eventually die because of that illness. Then it's called an expected death, because either sometimes with the treatment you can get better, sometimes treatment don't work and things can go downhill, and patients can die because of the disease, which is a natural process. So in that case it's called an expected death. I've mentioned before as well, coming to the mosque, that there's something called advanced care planning, and we should all be doing it. Just like Islam says about wills, making your will, it's a health will, basically, healthcare will, you can call it. How would you want to be treated towards the end of your life? Because when you're unwell, you don't have your mental health in the right place to make those decisions. So when you're fine now, you can make those decisions. Then where you want to be cared, how you want to be cared, you want your family around you, you want to be in hospital, you want to be in hospice. So there are a lot of things to consider. So this is a very important thing called advanced care planning. It's like a health will. It's not a binding document. It is something that you can make today, change it tomorrow, just like your wills. And it's something you can discuss it with your family as well. So family may be aware that this is what my wishes are towards the end of my life. There are certain diseases like cancers where we know that person is going to go downhill and death will approach, and in that situation we give them end of life care. And in this end of life care we do very important discussions about resuscitation or reviving your heart. It's called resuscitation or CPR as well. When somebody is very unwell, elderly, with lots of diseases, CPRs are often very painful and not effective. So we do those discussions, and then we'll say that if there's an agreement with the patient and the family, then we'll say this patient does not want to be have a CPR done at the time of death. So let the natural process follow. So you can make those decisions now rather than when you're unwell, because you won't be in a state, and family members find it difficult to make those decisions for you because they love you, they don't want you to go away. But there are certain things which cannot be revived even medically, so something to consider in future. And it's important is to discuss with your family members. Normally what happened was, when there was a death certificate could be issued by your GP, and that was a GP would have seen you in last 4 weeks or a month, in last 28 days. If he hadn't seen you, he had to actually refer the death to the coroner for investigation. That has also changed now, so I'll come to that. So this was the old process. Once the death was confirmed by a clinician, by the doctor or paramedic or out of hours doctor, you would then call your GP in the morning, and GP would issue a death certificate if he's seen you within certain time, 4 weeks, and that death certificate was sent to registration office by email, and then your funeral director would arrange the body to be moved into the mortuary, and the burial process and funeral process and burial process would have followed. So since 9th of September, the law has changed now. there is introduction of something called medical examiners. This is an extra body that has been created to scrutinize all the deaths that happen, to make sure that causes of death is rightly stated on the death certificates. There's no harmful circumstances in which the death has occurred. So the medical examiner's job is to provide an independent scrutiny of the cause of the death, give family an opportunity to ask any questions or raise any concerns if they've got any. So they will normally call the family members and review the medical records and work with the GP or the doctors in the hospital wherever the death has occurred to ascertain the cause of the death and to complete the death certificate. This is mandatory reporting. So from 9th of September, all deaths that occur in community which are expected deaths will be referred to the medical examiners by the doctors in the hospital if the death has occurred in the hospital, by the GP if it's in the community. And doctor, previously it was like last 4 weeks, if doctor has seen you will issue the certificate. Now doctor can issue the certificate if they've seen you in lifetime, cared for you. So there's not a restriction now. So the doctor who's looked after you in your life would be able to give a death certificate
after the medical examiner.
After the medical examiner. So I'll come to that process in the next slide. So what is the new process? The new process involves that in community setting, when the death, expected death, is reported by the family to GP during the working hours or 111 service in out of hour situation in evenings and weekends. GP will come out or the clinician from out of hours will come out. They will confirm the death. So death confirmation does not mean death certification. So that is confirmation that the person has now deceased. The body will stay at home. GP or that doctor who's involved will start the process which is called medical examiner's scrutiny process. So there's an online form that we have to fill in with all the details and the proposed cause of death, and we send that form by online to the medical examiners. They are not in Cardiff or that we can see them. They can be anywhere in Wales. So this is a remote service. So we send them. Within 6-7 minutes the form gets to them. On the form we put your medical details and a proposed cause of death, that why death could have occurred in this situation. There is a box of the form in which we can say that there was some concerns or there is a religious priority to be given. But this is something we as Muslim doctors, we know our patients, but sometimes some GPs might not be aware of cultural differences. So you as a family member or a relative, it's your responsibility to make sure the GP is aware that there's a priority for this death certification because of the religious nature.
They've raised this point with medical examiner and he said we will prioritize.
Yes. So we did in our meetings with them, we did raise this. Dr. Zahid actually raised this point as well, that we have this issue where there are religious obligations to be completed, and they said they will prioritize it, but they have to be informed of it. They automatically wouldn't know by a patient's name or ethnicity who they are. So you have to inform them, and GP will send that forward to them. So medical examiner, once that receives the form, they are given remote access to your medical records. They'll look at the medical records, they'll look the details of the last consultations, last investigations, and then after discussing with the GP or the doctor involved, they will ascertain the cause of death, and they will advise the GP that this is the cause of death. Now the GP will be able to issue the death certificate. So death certificate will be issued. Previously, death certificate was issued by GP and sent to registrar office. Now what will happen? GP will issue the death certificate and send it to medical examiner again. And this is also has to be scanned and sent through the email to the medical examiner. Medical examiner will complete another form called ME2, which is his part, and then he will issue both forms, ME form and the death certificate, to the registrar office. So you can see there are a lot of processes involved. and this can cause delays as well. Once the registrar office has received, the registration process is complete, then the funeral director takes over, moves the body, and funeral arrangements follow as normal then. So the possible issues here are, although we want the things to be prioritized and we understand the family is going through the pain and grieving at the difficult time of death, and they want things done quickly, but some things are not within our remit or within our hands. So we would try to do as much as we can, but once things are over to medical examiner, they only work within working hours. So if death occurs in the evening, none of the GPs will be able to give death certificates now going forward. And also medical examiners work during the same hours as GPs, so they will be informed, they'll pick up the case, and then next morning likely is that they will prioritize it and follow it through with the GP to issue the death certificate.
So in the meantime, if someone dies, I die in the house, what will happen? No GP available, no medical examiner.
Yeah, so if a death happens during working hours,
Yeah.
obviously you call the doctor.
Yeah.
It's an expected death. Unexpected death, you call ambulance, or that's a different process. This is the death of an patient who dies at home, who has been unwell, and GP has been seeing it, and we were expecting that because of the illness the patient was expected to die. So in that case, you will call the GP. GP will, if it's working hours, 9 to 8 o'clock till 6:30, GPs are open. So you call them, GP will come out, confirm the death, start the process of the death certification with the medical examiners. It will be prioritized in case of Muslim community, and the death certificate is likely to be issued on the same day. But if it happens like say 5:30, 6 o'clock in the evening, then likely is next day.
Are we allowed to move the body?
So
That's the question.
yeah, body is not moved until the funeral director gets the form from the registrar office.
The body will stay in the same premises.
Yes, but you have to speak to your funeral director what the process involves then, about moving. Likely is that funeral directors will be involved, because when death happens, funeral directors are involved very early in the process.
What I'm trying to say is that if the medical examiners are not available in a weekend, someone dies Friday night, so he will stay in the same premises.
No, so the body in that case is moved into the hospital mortuary then. Yeah, so body is moved into the hospital mortuary, and because you can't keep body 2 days because it's going to go into regular mortars and stuff. Yeah. So body will be moved into hospital mortuary, and then it will be released after the death is registered to the funeral director again. So we as GPs have no say over how long it will take. So I understand it's a difficult process for the families, but you need to have a little bit patience. Sometimes what happens, we see families going to doctors, obviously trying to expedite the process, but it's quite difficult for doctors to do that now going forward. They would have, if you have already informed them that there's a priority, then that priority will be noted and informed to the medical examiners.
Over time, we'll have discussions with medical examiners. We will have discussions with medical examiners about this issue. Yeah. So we'll make sure that process is as soon as possible and as smooth as possible. So we'll continue our discussion with them.
So over time, we should get, inshallah, 24-hour access.
Yeah. So it's a new process. We are all going through it. Obviously, there would be things to learn from it and report back. We are part of your community. We understand these problems, and we do take it on all the forums we can. As I said, there are GPs who are not from our religion, and they might not understand Muslim culture as we do. So you need to be a bit more patient and respectful to the staff and the GP teams when you go there, because they can't do anything. So it's more about understanding the process. So today I was just here to make sure you understand the process, but obviously things will evolve more or change. I will come back and explain you better than if there's any differences going forward. Jazakallah. So one more announcement before I end this. On 16th of October, Wednesday next week, there is a minority ethnic community health fair in Cardiff City Stadium. It's a very big event. There are about 70 odd organizations who come there. I will be there myself, and I will be providing health checks with my team from Muslim Doctors Cymru. At the same time, there is also hepatitis screening service available as well. There is other diabetes network. There is dietitians there. There is third sector mental health people there as well. So yeah, lot of opportunity about health awareness and health checks. So if you've got time, please do come in from 10 o'clock till 3 o'clock. We'll be there, so you can come anytime. There is also a question answer panel as well, so there will be health professionals. I will be there myself, so you will have opportunity to ask the doctors and specialists about any services, any questions. So that will run from 12:30 to 1:30 in the afternoon. Jazakallah, Mufti Sahab.
Jazakallah khair. Alhamdulillah, inshallah ta'ala. What Dr. Saab just said about the medical examiners, and they're going to be in certain hours. Inshallah ta'ala, our Muslim community will push. Inshallah ta'ala, we'll try to make this a bit hasty, inshallah, but it will take time.
الله لا إله إلا هو له الأسماء